Hi.
Hello.
Hi, this is Brian and Christina from Your HealthySteps. We're the creators of the Ultimate Foam Roller Blueprint, and we help people learn how to foam roll and do self-care so you can be active and pain-free.
Absolutely.
Yeah, so this is for educational purposes only. We're sharing with you 15 years of experience as neuromuscular massage therapists, and this is definitely a conversation we've had with our clients before, and we wanted to share this information with you too. So if you are foam rolling your pecs, you are unfortunately missing this little muscle over here.
Good bet.
And it's an important muscle to know about if you are working on improving your posture.
Yeah.
It plays a big role in posture.
Absolutely.
And so we're going to be sharing how this muscle affects your posture, how you can find it yourself. And tomorrow we're going to talk about the pain referral patterns.
We're going into more detail. Yeah,
yes.
Absolutely.
And then
some stretches.
Some stretches that you can do.
Yeah.
Okay, there you go.
Well, so basically we've been talking a lot about the muscles in the front of the body. And because a lot of those, especially in the upper body, they can create tightness in the chest. It can create tightness in the arms, affect the movement of the shoulders, tightness in the back of the muscles. So, in our back. So these are really important muscles, especially since we're talking about posture. And this muscle is absolutely part of this, but it's a fairly small muscle that most people don't even know it's here. So we want to just mention it because they can create some problems, pain patterns that are very odd, I would say very odd. And then it's just going to affect trying to get us into really good posture. This one's going to be a big part of that. So we're going to introduce this muscle, and this muscle is actually called subclavius.
Yeah.
I know it sounds like a Roman general, right? Subclavius. But that's the name of this muscle because of its location. And Christina's going to, when we talk about where this muscle is located at, I think the name subclavius is going to
it makes sense.
Yeah, and there's a lot of muscles in the body that the name actually shows you or tells you where it's at, which I think is brilliant.
He gets excited about all
I really do. It's like I'd like to know who named it because I'd like to give him a high five. It's like this, because when you're studying anatomy, names can be killers.
Okay, well, let's find our subclavius. Okay, so as you can see, it's on both sides of our body, as is with most muscles. But it's underneath, it's below the clavicle, subclavius. Okay, so the best way to find it is if you take your finger and you put it in that clavicular notch right up here at the base of your neck. And then if you just move your finger over, you can feel that bone. It's just your collarbone, right? Or your clavicle. Okay, so now with your finger on your clavicle, just drop it underneath. Just tuck up right underneath that clavicle. And if you start here, right by the sternum, and you have your finger right where the sternum and the clavicle meet, that's where this is where subclavius starts. It doesn't attach onto the sternum, but it actually attaches to your first rib. Okay, so if you take your finger and you just walk underneath your clavicle, you're not on your subclavius because it's underneath the pec.
Yeah.
Right?
Yeah.
And then if you continue walking towards your shoulder and stay underneath that clavicle, now you're going to be touching your subclavius because the pec has ended. And a neat way to see if your subclavius is tender and tight is if you roll your shoulder forward. Look how my clavicle pops out. My finger is tucked up as deep as I can underneath that. And now I can move my arm back and forth. And as I'm pressing there, I can feel maybe some tenderness. Okay, don't do this if you have long fingernails. Right? Because then you're going to do acupuncture. We don't want acupuncture.
And you can work along that edge too, and it's fine. We'll talk about that tomorrow. But again, you're not actually on the muscle until you get more toward, like Christina said.
Okay, so that's where your subclavius is. When you are touching it, is it tender on you? And you could always do your other side too and test it out. Okay.
So now we know where this muscle is at. What does this muscle do? Well, the way it's attached here, it actually helps pull your collarbone down so it's more level, or it's supposed to be. But the part that affects your posture is that it will also bring your clavicle that way. So it's going to pull you this way when it's really, really tight. And it does a couple other things. It helps to elevate your first rib, which is really important, but it also stabilizes this joint. So where the clavicle comes into the sternum, the top of the sternum, there's a joint there, and that joint there's not a whole lot of movement here, but it's the movement that's there or should be there is really important. So it just stabilizes that joint. It makes that joint, or helps that joint stabilize so it's not all over the place, and that's really, really important.
Yeah. And I actually had 2 clients who had one lady, her collarbone was a lot higher than the other. She just came in one day and she goes, what's going on?
Yeah.
And so I wasn't really sure, honestly. but I worked this area and worked as much as I could, and it leveled off.
Yeah.
So that was one indication, or one event where the subclavius went a little crazy.
Yeah.
And then another lady, she actually, these 2 bones dislocated because the subclavius was so crazy tight.
Right. And it can be ridiculously tight.
Right.
And when we have people who have had shoulder issues, maybe they're seeing a physical therapist because of shoulder issues, or they've had surgery, this tends to just be ridiculously tight. And so it's one of the areas that we work on when we have somebody who's had shoulder issues.
Right.
Yeah.
Yes.
And it's tender, to say the least. Yeah. It can be quite painful. So that's okay, because it's all good as far as working that out. So we talked about what this muscle does. So how do we know if this muscle is tight? Well, generally speaking, if your shoulders are more rounded forward, it's a good bet that this muscle is tight. It's involved in with the other muscles that are causing us to be rounded. If you just have really tight shoulder movement, that's another good indication. There's pain patterns, which we'll talk about tomorrow. That's really good indications. And just overall, generally tightness and rounded shoulder. And difficult to trying to get yourself into good posture.
And if you press on the area, now you know where it is. If it's tender, there you go.
Bet.
That lets you know it's tight.
Yeah.
Okay. So make sure you check out the comments below, because there's going to be a link. And if you found this to be a helpful video for you, we have lots of other great information for you in our free classes.
Yeah.
So follow that link, and that way you'll be informed of our next class that we're offering. Okay?
Yep, and join us tomorrow, because we're going to go into more detail of where the pain patterns are in this particular muscle, where the pain refers to, and how we can do a little bit of self-care and some stretching that will really help take care of this muscle.
Definitely. Okay. Good deal.
Fantastic.
Okay. Bye-bye.
Have a great day.
See you tomorrow.